the PCTM pilot clinics. And we have a couple of people here are kind of new to our group. And then also we have some people that will be joining us in a few minutes. So I wanted to go ahead and just give a chance for at least Joellen and Stella, if you guys wouldn't mind introducing yourselves to the other people that are attending today.
Thanks, Laurel. Joellen Colson. I work for the Healthcare Authority and am involved in primary care transformation efforts. So certainly look forward to learning from all of you, and thanks in advance for the great work that you're doing for the patients and clients in Washington State.
Hi, good afternoon. Stella Jing, Healthcare Authority. I work for Joellen and work with her on primary care transformation, and am working on developing the primary care practice recognition program for the state. So thank you for letting me sit in on this meeting.
I'm so happy you guys are here. This is great because you can maybe answer some questions that might come up that I wouldn't be able to answer.
Oh boy.
So just to let you know, so there's a couple people from, there's actually 3 people from Greater Health Now. So I'm not sure if Anna's available, but I can introduce Harvey. And he's new to Greater Health Now. And so Harvey, if you wouldn't mind just saying hello and talking about the work that you're going to be doing for Greater Health Now.
Yeah, hello everyone. My name is Harvey. I just joined Greater Health Now not too long ago, a couple of weeks ago. I come from Catholic, but I was hired to start the mobile unit, health unit project, and so we're going to be getting that off the ground, working together with Washington State University and the Birth Justice Center, as well as the Center for Latino Leadership. So right now I'm just trying to learn everything about the role and about what the company is doing, and I look forward to learning from all of you.
Great. And then let's see, we have another individual that's newer to Greater Health Now. Michael, would you mind saying hello and talking about your role?
Sure. Looks like, oh, here's my camera. This is kind of weird. Hi, everyone. I'm Michael Hatch. I'm a community data research consultant at Greater Health Now, and been here about 2 months, and talked a little bit with Laurel about the PCTM and great work that's being done, and just really interested in hearing more about it and kind of the plans going forward. So thank you.
Okay, perfect. I think that those are the newer individuals. So what our topic today is the primary care practice recognition program, I guess you'd say. It's kind of hard to explain in the sense that we've all been working on it all year, those of us who are more regular attendees to the shared learning webinar, and we've called it the PCTM. So as we have encountered it and we've done this pilot for the Healthcare Authority, it's kind of fun to say, okay, so what's one thing we can do as kind of, I don't know, taking credit for a lot of the work that's been done. I'm so excited about a lot of the work that I've been seeing from our third quarter reporting. There's been such growth across the clinics. And so it's been a really neat process, and I'm excited to see about the fourth quarter as well, to see what we have shown for growth. So without further ado, what I want to do is just kind of give you this update on the primary care practice recognition program, and the topic will become more obvious as we progress through the slides. But let me share my screen to show you just the quick PowerPoint that I have put together for our meeting today. Okay, hopefully, are you guys all seeing the first slide?
Yes.
Okay. So the Healthcare Authority put the model together originally, and then we are piloting it for us. And some of these slides Stella graciously gave to me. So I've incorporated into our discussion today. But just the background, the primary care practice recognition program is a critical component of advancing primary care transformation. And it's also centralized and administered by the HCA to reduce burden. And HCA convened a work group of providers and payers to define the 10 provider accountabilities, how the accountabilities will be evaluated, and level assessments. So all of us have been doing PCTM. We're quite familiar with these 10 provider accountabilities. And I know you've heard me say on a number of occasions that this was developed with two work groups, a work group of payers and a work group of providers who came up with a model that we've been using all year. And so there are the accountabilities and a way to evaluate it that we've been doing. And then there are level assessments. And as I mentioned before, I'm seeing a lot of you level up on your from your assessment over this year. So HCA has built an application and workflow process to collect data from practices. So it will be released soon. We don't have an exact date on that, but they're in the final processes of testing and hope to have that out definitely before the end of the year. So what I wanted to do was share what it kind of looks like and what this process is, so we can give you an opportunity to participate in and contributing data to this application. Oops. This is just a reminder, those are our accountability areas. So whole person care, sorry, a team for every patient, resource allocation strategy, behavioral health integration, patient support, the care coordination strategy, expanded access, culturally attuned care, health literacy, and data informed performance management. So this is like a review from the HCA on, it is the same, all of the aspects, the criteria within the PCPR is the same as the PCTM. So as we're aware, level 1 is you're meeting the minimum standards and working towards transformation. And 2 is active progress towards transformation. And 3, provide most or all of the accountabilities. So when the application is available, this is a process that has been defined for how it will look to go in and submit your application. So starting off here in the corner, you contact HCA, and then the practice will get an email with your PCPR identifier and instructions. And then that you'll navigate to the HCA portal and the link for the public. It requires you to get a secure access Washington access to be able to get into secure access Washington to make sure that everything is safe and able to be stored in a manner that we need to for security reasons. You enter credentials, and we have a little more detail on what that looks like. That once that information is completed, it goes to HCA to make a request. And then when you're in, and I'll show you the next page, it'll make more sense. You'll select providers, and then you click on the PCPR application tile, and then you click the option to start your application. Then you put the input and your make sure that it's valid, and then have your PCPR identifier. And then you answer some questions, and then you submit the application. And then there's a back and forth process that the HCA can, if they have questions, or if, maybe there's something that wasn't filled out for some reason that they need more information, then there's this back and forth. And once it's all done, then you get a notice of approval. And then a reviewer team uses PCPR dashboards and reports. So Stella, I don't know, do you want to add anything on any portion of that workflow process that I might have not covered?
No, I think you covered it really well. In terms of like the back and forth piece, yeah, that will only come into place if we feel like we need just like a little bit more information from you, or something wasn't clear. But yes, it should make sense when the other slides come up.
Yeah, and as you know, none of this is completely final yet. This is just, I guess we should have a big draft like over this slide, and in case anything else comes up to add to the process. But we get the general idea of, how it's going to happen. It's an electronic submission. And if there's built into this process, there's an opportunity for there to be some back and forth communication as indicated. So and does anyone have a question that about this so far of what I'm covering? Okay. So this is just, simply the primary care practice recognition application. This is what it looks like right now. So I got to test it with Stella and the developer, and it works really nice. It's not difficult, but you can get an idea from looking at this slide of some of the information that would need to be input. So your tax ID, NPIs, Medicaid ID, names, addresses, and other information. So this is it's a really nice process that you go through when you set this up. And there's a really nice section that says, if you didn't get a required field, it kind of shows up on the right side in red, so that you are set up to succeed on your first attempt at entering all of the information, because all of those it's not only that there's asterisks, but there's little red flags on the right side of the page that help you know, oh, I haven't done that yet, or I have this many more to go of my required fields. So I think that's a really nice thing that they've built in. So this is really nice as part of the application process. I hope that all of you will do this. We'll talk about it more as we go through this presentation today. But it gives you an opportunity to talk about what training and technical assistance would be helpful. So, we've worked really hard over the year on some of these things: behavioral health integration, care coordination, health literacy, data systems, and analytics. But as you are continuing to work, I'm sure that you can maybe want to check all of these boxes, but at least giving the HCA feedback on where you as a practice really is so important for you to get some assistance. And they are going to be gathering this data. So I appreciate the opportunity for us to go ahead and fill in whatever our pain points are, or whatever would be most helpful to have more technical assistance on. So there's that part of it. And then so much easier than what you guys have been doing with me. When you, instead of having to go into a reporting portal that you do and upload all of your demonstration of your competency as far as policies or procedures or narratives, this is just for each area of the model that we're working on, all 10 accountabilities. It's the same ones that we have, like 1A probably looks quite familiar to you by now. It's an attestation within this Excel spreadsheet. So you say yes, and there's the point level, and you say yes or no. So each one is just an attestation. So you all have a great advantage of going ahead and contributing to this database because you know exactly where you are, you know exactly what is meant by the verbiage in each one of these areas and under the 10 accountabilities. So it basically the spreadsheet is set up to you fill it in and then you'll know at the end of it what your level is. So, and of course, all you guys already know what your level is. So, Stella, anything to add or comment on in regards to this spreadsheet?
Yeah, I think yeah, I think you captured everything. I think the nice, or like the thing that we're hoping is nice about having this Excel sheet, while you know, everyone on this call has worked through all the accountabilities and has had a chance to figure out where they are in terms of the 3 levels, it will really allow people to kind of, because this is the meat of the work, right, of applying for recognition, like having this format will be helpful just so you can take it offline and do this part first and figure out where you stand. And so when we're looking at, you know, sequence of steps in applying for recognition, you know, the first recommended step is that practices work through this workbook and figure out, like, you know, where are we? Take stock of, you know, where are we excelling, right? Like, what are the places that are our strengths, and then here are the places that we, you know, we can potentially spend additional effort on. And so, yeah, I think that was our intention, is to kind of have that be a tool as well as part of your recognition application.
So, my clinics that are on the phone, I'm wondering, I can't hear any sighs of relief, but I would think that you guys are going, well, that's easy. That's like, it's a kind of a no-brainer for you guys. So, okay. So then, same, you know, this should look familiar to all of us. As far as level 1, level 2, and level 3, there's a points threshold and a points earned, and then there's the mandatory criteria, you know, that we've met. It is exactly what we've been working on. So that's what the Excel spreadsheet does. You know, it kind of calculates up everything that we've entered and attested to. So, and then I don't have this on the slide, but I think it's important to mention that included in the application is a letter that will need to be uploaded from your leadership, asking for, I'm not sure exactly the verbiage, but Stella, is it just saying that you agree to having your site evaluated using this tool?
Yeah, it won't be anything, you know, cumbersome. It won't be like a grant application letter or anything like that. But just acknowledging that, you know, you're participating in the recognition process. I think one thing I'd like to add, to maybe just like give context, is like the recognition program. You know, the primary reason is like we want to celebrate, right, the efforts, our practices are working on to provide comprehensive, you know, whole person primary care. But we also want the results of this program to be able to support practices, right? So I think, as Laura pointed out, like the training interest section is really important. Like the data that comes into the recognition program will help us figure out, like, can we help target like learning opportunities or technical assistance towards health literacy, for example, right? Like if that's an overwhelming trend we're seeing across the state, then we can say, okay, yes, like this is worth like kind of just targeting a lot of efforts towards. And so, yeah, like the primary reason is like we want to recognize the work that's being done in the state and understand what's going on in the state, but you know, we want to be able to use this data to support practices. So yeah, I think just the letter is like an acknowledgement of like, yes, we are part of, you know, we are part of this primary care transformation effort, and we want to participate in the recognition program. So we will definitely have like an example of like what should and shouldn't be included in the letter to help guide practices when they are ready to apply.
All right. Thank you, Stella. I appreciate that. Okay. So one of the things I wanted to point out is like, and I've mentioned this to, those of you been part of this pilot the whole time, is like, I'm super excited about the MOU that was signed in July. It was to me a big deal to the alignment of the pairs for having, recognize the work in the PR. It's like, it was just mind-boggling. And I actually got to be present for it and see like the people who were really all in the same boat about saying, we need to help out primary care. We need to bolster. This is important. This work, multi-payer alignment work makes so primary care clinics are not having so many different deliverables, for different organizations that are asking for things. So just the MOU, and it's publicly available, and I put the link here, and I highly recommend you guys that have been working so hard on this pilot going and looking at it. So I've highlighted a couple of sections from the MOU, and I wanted to share, with you, like, well, who did agree, so you'll see the signatures when you look at the document, but here's a list of all of the payers who are signed the MOU and agreed to what's within the MOU. So that's pretty exciting. I hope that you guys are excited too. But anyway, so I wanted you to see who, and then this is high level, sorry, of what was agreed to. So, so one was ongoing and active participation in the Washington Multi-Payer Collaborative to foster collaborative support strategies for primary care. So the Multi-Payer Collaborative are those groups of people that came together to come up with a model, and also to come up with the payer group with, alignment on how to set up payment models and agree to them. And then the second one was adherence to the Washington Multi-Payer Collaborative's alternative payment policies for primary care. So it's within the MOU that you can look at and see what it says. And then use of the Washington Primary Care Practice Recognition Program to inform provider partnership and contracting strategies. So this is just one piece, but it's kind of an overarching piece of what was in that MOU. I think I missed a page. Okay, so this is a model. It's illustrative, not to scale, and for those of you who are participating in MCP, you'll note, that looks familiar. I think that's intentional. So again, when you think about alignment, we're meant to be having this as much, it already is quite similar to MCP, what our model that we've been working in has been. But when you look at this, it's like I see some similarities. But so early on, there's a potential for the upfront infrastructure investment, and then moving forward, potential for upfront infrastructure investment to continue, and then fee for service or alternative payment methodologies. And then with level 3, looking at you're ready for a prospective payment. And so just working with payers to, you have a tool from having done this to demonstrate what you've done, how you're doing it. And when it comes to the different accountabilities that you've demonstrated competency in. So for those of you like, wow, this is so exciting, woohoo, it's like, oh boy, but there's all these exceptions that are in even in the MOU. And of course there is. I mean, when you think about multi-payer alignment, this is no small piece of work. There is definitely a desire for alignment, but then when you get down to the nitty gritty of how to, it's like, oh boy, you've got all these different organizations with all of their different operations, and even like patient attribution models, and there's just so much stuff. So while everyone agreed to the trying to come in alignment, there's also lots of caveats and lots of work to be done. So I just wanted to, I thought it would be only fair to pull out from the MOU as like, okay, look at all this stuff, so it, want you to be fully informed when you're thinking about where you're at because of your participation, and also what opportunities are out there for you. And so I guess, I always want to answer this question. Well, why? Why should we do it? Why should we complete the application? So I think it's important. We are trying so hard to bolster primary care. We all know how important it is in the whole healthcare infrastructure for everybody in our state. So this is an opportunity to add to the ongoing work in our, that's a typo, state to accomplish multiplayer alignment. That it would be such a sad thing to like lose the thread on this work that's been completed and so much that has been done. It is good work. And so by adding to the database, I think it is very important to contribute to that, and anything that we can do to keep this work moving forward. And then to position your organization to leverage the work you're doing to aid in advanced payment contracts. So, it creates a common language. We'd like for it to continue to grow and have this language spread among, many clinics and many payers. And actually just for you guys, as opposed to all these other clinics that haven't worked with the model so intimately. For you, it's easy. So why not? So I'm going to stop there and just see if you have any comments or questions. So what I want to do with this is kind of go around and have you actually go off camera and share with me what your thoughts are, or if you have any questions in regards to the information that I've shared with you about the PCPR. So I am gonna start with Michelle Sullivan and see what you have to share with us.
I have a couple questions about the application process, and is there a frequency that we would need to renew it at, or is there, like, if you came in at like a level 2, is there a period of time that would need to transpire before you could resubmit at for a level 3?
Yeah, Michelle, those are great questions. So to address the first part of your question in terms of when you get recognized, how long is it good for? So for level 1, your recognition will be good for 1 year. And that was purposely set because we want you to kind of, if you're just like getting through the door and starting at level 1, we kind of want to make sure that we're checking in with you in a year. If you're levels 2 or 3, your recognition will be good for 3 years. So you would not have to reapply for another 3 years once you've been approved. In terms of like, if you're at a level 1 or a level 2 and you're like, hey, I actually, met these different capacities in the last 3 months, and I want to go, I want to be recognized at a higher level, there is no like time limit. Like, you're not boxed in, like you have to wait a minimum of certain amount of time before you can apply for the next level up. There is no restrictions on that. So it really is up to the practice, and when they feel like they are meeting those capacities and at that point you can go ahead and submit for the next level.
Okay, thank you.
Yep.
Any other question, Michelle?
Nope.
That was a great question. Thank you so much.
Sure.
So, so Michelle's from Yakima Neighborhood Health Service Site. system
Services.
I get used to the acronyms and whoop, YNHS.
YNHS, yep.
Yeah. So, and it's been just, I mean, just the growth that we've seen and with YNHS and moving these forward, it's great work. So, thank you, Michelle. And then I want to go ahead. Marcia, are you there? I know Marcia has clinic on this day, so she tries to tune in. So we'll check back with her in a little bit. And Sarah, I don't know if I've met you before, so would you mind introducing?
Yes, I'm with Tri-State Health in Clarkston, and this is one of those instances where you arrived in a class and it wasn't the class you thought it would be. But this has been great information, and I plan on passing along to Jolene and Dr. Sieber here at Tri-State.
Well, it's not a bad thing. I am very excited because I did a lot of the practice transformation navigation in Waiver 1, Sarah, and we loved working with Tri-State. And so a lot of the things that are in this model are things that you've already done at Tri-State.
Very good.
So yeah, so I'm glad you're hearing this conversation. And if you want to reach out to me, or if your team wants to reach out to me, please do. I would be happy to provide more information and share information about what we've been working on all year and where you guys might want to hop in and join in on some of the work.
Wonderful. Thank you, Laurel.
Yes, yeah. So Laura, can we have you go next?
Sure. And sorry if I missed this, Laurel, but as far as the process and the timeline for filling out the application and then kind of, I guess, hearing back ultimately, I guess the end of that, the beautiful process of the boxes that you had, kind of what's an anticipated timeline for that whole process to be completed in, or what would you expect?
So I'll start, Stella, you can kick in. So when you complete when you complete the Excel spreadsheet, like, right away, you're like, oh, but you already know that because you already know. But as far as any other type of communication, Stella, what would be the timeframes?
Yeah, and I apologize. I forgot that I was off camera. Thank you for the question. So yeah, once an application is submitted, while there will be some language in some of the guides and instructions that, HCA gives ourselves, I think like 45 days, you'll most likely hear back much sooner. I am a team of one right now, and so I had to hedge that a little bit and make sure that I wasn't over promising. But like Laurel said, this is an attestation based application, and so unless there's something very alarming within your application, it should be a pretty quick process to get the approval back to the practice.
Yeah, it seems very straightforward and, like Laurel said, easy. So appreciate that side of it as well. And a lot of the work, I think, Laurel, that we've done kind of help preps for that. So which I think is really helpful. So thank you. That timeline is helpful.
Yeah, and just so you know, Stella, so Laura is representing Cadlick and Providence Medical Group. So Cadlick's in Richland, Washington, and Providence Medical Group is in Walla Walla.
Okay, great. Thank you for that context.
Yeah. Okay. Yessie, did you have anything to add?
I don't at this time.
Okay. So Yessie's from the same organization and representation as Laura. So I just have enjoyed having her input and help on things this year. So I want to give her a chance. And so I'm going to call on Kim next.
Hello.
Oh, I have
So
two Kims. So we
Oh,
got
I'm
Kim
sorry.
Emery first. No, good. Kim Emery is from Columbia County Health System.
I'm not used to having more than one Kim, so sorry about that. So this is very exciting that the payers are working with us after many years of being in many many collaboratives and different things over the years. I'm very excited about this. So just anxious to start working on it, but not so anxious that I need to jump in right today.
Kim, one thing I was wondering, I know that you participated on with a group to come up with some of
The measures.
measures, the
Yes.
quality measures. So would you mind sharing a little bit about that?
So there's the quality measures, and then this is between like the Department of Health and the Healthcare Authority. And so we have had meetings where they have input from all different entities, and I'm there to represent rural health. There's two of us from the collaborative that were on there, and we're having an ad hoc um, group now to talk more about rural. And some of the things are already set, but some of the things we voted on as far as like, how do you measure this? What's the numerator? What's the denominator? Because we all know that some of these things are so confusing. And when you get down to it, you go, we did blood pressures on 500 people and it only counts for 45 of them. What is going on here? But there's always all of the stipulations of who can be in the denominator and who can be in the numerator. And so we had discussions about that, and then there was voting, and then some of it was just to get our information, and it was kind of already, some things were like already set, and then some things we had more input on. So that came out, in the last month, because I think I went over for that meeting last month. But we have another meeting in December. So this will be ongoing so that we can all be on the same page. And we're trying to get on this same page because there's NCQA has this measure and HEDIS has this measure and this person has this measure. And can we kind of get them together? Because it's very hard when you're using practically the same data, but it's a little bit different. And we all know that our EMRs do not just at the turn of a hat, you can like, well, let's just do a new report and use it like this. So it was interesting being on that committee and learning some of these things.
So thank you so much, Kim. And what I'm sharing to show on my screen is part of the MOU, from the multi-payer agreement. And so this is the quality measures that were agreed upon as part of the MOU. But
I will just say, Laurel, there wasn't like it was mentioned, the ad hoc primary care measures work group did make their final recommendations, and I do think that they differ a little bit to what's in the MOU because it recently was recommended for approval. So I will follow up with our quality manager and see if I can get a copy for this group.
And I think, we all kind of realize, Stella, it's always a work in progress, but to me, this is kind of a starting place of like, hey, we're trying, just convening a group of payers, like Kim said, and like just looking across different entities that are asking for this information from clinics. It's just a breath of fresh air to think about it. Even if this, wasn't the final set of metrics, but just that there's someone thinking like that at the state level, and that we're striving towards it. And it's nice to have Kim be able to share that she's been asked, as from a provider standpoint, to participate in that instead of it just being given to her. So I'm really happy about that. And thank you for adding that piece, and whatever information you can provide, I'm sure everyone will really appreciate it. Okay, so Kim Selsler.
Hello, Laurel. Filling in for Stacy, so
Yeah.
I don't have any questions, but I'm sure she will.
Yeah, I know. Wish she wasn't able to be here today, and I know she would be appreciative of all the information that's shared. And Kim's been working really hard at the clinic level on all of these accountabilities and doing great things. So hopefully it looks pretty even more straightforward, and of course, than what we've been working on, and be really really nice. It's just an attestation for this one since you've already done all the work.
This is being
So,
recorded, right?
yes.
Oh, it is. I see. Okay.
Yeah. So, okay, I'm looking to see if I have missed anyone. And I don't think I have. So I just wanted to go ahead and give anyone an opportunity, final opportunity to ask any questions that they might have in regards to this and how it fits in with our work. And then you can even branch out to say, okay, if there's anything about our pilot that you have questions on. And I'm not hearing any. So I get to give you guys a few minutes back in your day, which I know is a busy one. And I really appreciate you signing on, and we will look forward to our last month together on this pilot. So just the rest
Sorry,
of November.
Laurel.
Yeah.
Could I ask maybe a question? Not a
Yes.
question, but like maybe just put a little bit of a a potential ask. As Laurel mentioned, she did participate in some of the testing with me and the application, and that was extremely helpful to get some insight from her about the application of itself. We are interested in potentially having a few practices or clinics also maybe run through it, and so if folks are open, I may follow up with an email to see if there are any volunteers, because we want to make sure, I think Laurel's input is extremely valuable, but we want to make sure, like Laurel said, like the intent behind primary care transformation efforts are not to build something in a vacuum or have us prescribe something to everyone, but to really like approach this in a collaborative way. And so if folks are interested and willing to give me a little bit of time, I'd love to ask folks to take a look at the application before we launch it. So just putting it out there.
And I think you've already gotten a response in the chat, Stella. So I would just like to say to the group, if you're a little like, uh-oh, I don't know if I have the time. So we did it in an hour, I think, Stella. You didn't take up much of my time.
Yeah, and we can definitely work on that same format where we give you a little bit of intro to get you set up in terms of like what the UAT concept, like the user acceptance testing concepts are, and we could do that in a pretty short amount of time and have folks kind of go away and do the testing on your own time. But yeah, we would try to make sure that we can kind of use your time effectively, because we know that everyone is very, 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 very busy. So yeah.
Perfect.
Thank you.
Yeah, thanks, Stella. Okay. Well, so thank you guys so much for joining today, and I will say I hope you have a great Thanksgiving, and we'll talk to you soon.
Thank you. Thank you.
Thank
Bye-bye.
you.